Good evening, good evening. It is 9 p.m. Welcome to Tuesday Tea Time with Sybil Green Padilla. Thank you for joining me. Come on in if you haven't already. As always, we have a great topic and want to see what you're drinking tonight. I have some chamomile tea. Interesting health benefits for chamomile tea. I was reading here. Benefits of chamomile tea. I'm just going to name a few because we are going to be talking a little bit about health and insurance tonight. And one of the great things about this tea is that it does reduce inflammation. Inflammation is a major cause. Well, I won't say the major. One of the major causes for diseases. Most diseases start with high inflammation in our body. So this is a great tea to drink for inflammation. Let's see. And then my other thing that I liked, it can slowly or prevent osteoporosis. As we get older, we know our bones and different things, bone density gets low. So we are more at risk for breaking bones. This is a great tea to strengthen the bones, preventing osteoporosis. It also treats or helps lower blood sugar and treats diabetes. So that's a real good one. Definitely that it is. And then also too, it's the other one that I liked. Helps with sleep and relaxation. You guys know I love tea that helps you with good sleep and relaxation. So chamomile tea, try it. I hope you like it. I do have a little bit of honey in here. And it always tastes fabulous. This is my tea before bed. So welcome again to Tuesday Tea Time. I'm Sybil Green Padilla. I'm a licensed insurance agent, licensed in 50 states, and I am here to do this every Tuesday night. I look forward to talking with you because this is our relaxation time from a long day. I get to talk with you guys and share some maybe important facts you didn't know or you maybe need refreshing on. I'm in the insurance industry. I've been doing this since 2008 and then 2011. Actually did it twice. So I've been in the industry for a while, worked for several companies. I'm an advocate for you, the client, the people. I'm here to serve you, answer your questions, no obligations. I'm doing this out of my own free will and to hopefully help you answer some questions. Insurance can be always say pretty confusing, and this is the atmosphere or the ambiance that I want you to, with the music playing, to be able to feel free to talk about it and chat about it with a cup of tea and see if I can get some answers for you, okay? So tonight's topic, as you saw, we are going to be talking about getting insured if you have some health issues. Insurance can be pretty tricky because a lot of times insurance companies will decline you if you have certain health conditions. I am here to say that I got you tonight. I have a company that I work with that is approving health conditions. So some of the major health conditions, if you're in, come on and say hi. If you have any health conditions that you want to question about it, just give me respond in the comments, the condition, and I can let you know. This company pretty much approves pretty much anything. The only three things that the company doesn't approve is if you're in hospice care, if your loved one is in hospice. Hey, Shalita, thanks for joining. If your loved one is in hospice care, or say if your loved one is any type of assisted living or receiving home health care or incarcerated. Those are the three main things where we cannot get an approval. But mainly, we're going to talk about some conditions tonight that you can get your loved one approved. That's awesome. Okay, I had to put on my spectacles here. All right, so let's talk about a few. And if you have some conditions or health things that you want to ask me about, just give me a comment below, and I can talk to you about it. Now, any type of heart condition any type of heart surgery, heart attack. Now, most companies usually look at within the first 2 years or first 5 years. Every company is different. This company is in the first 2 years, within the past 2 years. Have you had any type of heart condition? Now, that's usually a big one because the heart conditions, there's quite a few people that have heart conditions out there. And that would be a big one normally with a company where you had to do a full paramed, which means a full physical. Usually somebody comes by your house and they do your blood work, they do your weight, they check all of that, and they look at the medications you're taking. And usually that would, once you come back and those conditions are there, you probably will get declined. This company, I got you. Just in the past 2 years, any type of heart attack, heart surgery, or any type of congestive heart failure, guess what? We can get an approval. If you're on blood thinners, that is usually a knockout question for any type of insurance company. Most insurance companies will knock you out, won't totally decline you for blood thinners. Warfarin. That's a big one. Any type of congestive heart failure, I told you about that one. Circulatory issues, stroke, aneurysms, anything where you have had surgery to improve your circulation, those are going to be usually an immediate decline. Guess what? I got you. We got an approval for you. Okay, cancer. Now, mostly anything other than basal cell. Hi, honey. Anything other than basal cell usually will be a decline. And so I'm kind of naming these health conditions because usually when you're dealing with most insurance companies, you will get an immediately decline and they won't be able to help you. But I got you, and I have a great company that would help you with it. Any type of cancer in the last 2 years, other than basal cell skin cancer, that is going to be a approval. Disease of the lungs, that's COPD, any type of emphysema. This is other than asthma. Okay, we're not considering asthma, but COPD, emphysema. If you are on oxygen, you guys know that is usually a decline. So I'm so excited about this because I can help you. I have a company that we can help you get approved, even if you're on oxygen, your loved one's on oxygen. And I'm going to tell you the disclaimers and the ins and outs of it, but we can get you approval. I'm excited about that. Okay, disease of the liver, kidney, or any type of organ transplant. Kidney dialysis is a major knockout for life insurance. As you guys probably know, if you have any, we can approve kidney dialysis, guys. So let me know if you're having trouble getting approval or getting a policy. I got you, okay? So any type of liver, kidney, or organ transplant, if you have that, I can get you an approval. Alzheimer's disease, dementia, organic brain syndrome, or ALS, Lou Gehrig's disease. I don't know if you all have heard of that. These are major diseases, guys. Most companies would kick you out and would totally decline you. We have a company that will cover Alzheimer's. As we know, that's a big one. Dementia. Now, I'm going to put a disclaimer here. The Alzheimer's, remember the 4 things that we can approve. We can't approve of the Alzheimer's if they are in an assisted living facility right now, or if they're receiving home health care, we can't approve that. Or if they're bedridden or hospitalized in some type of care facility or incarcerated, okay? Also, HIV and AIDS, those are total decline. So I think that's 5. HIV or AIDS, currently bedridden, hospitalized in an in-care facility, receiving any type of assisted living or in hospice care. That's about 5 things. That is a decline no matter what insurance company you go with. But these are Alzheimer's disease where they're not any type of home health care or facility as of yet. That's great news, guys. Alcohol or drug abuse. This doesn't mean that you're drinking alcohol a little bit every now and then, or taking drugs every now and then. This means that you are pretty much hospitalized for an addiction for alcohol or drug abuse. This is not for anything like you drink alcohol or marijuana every now and then. This is actually we're in a facility for drug addiction or alcohol abuse or alcohol addiction. Okay, guess what? We can get you approved. Okay, and this is a legitimate company. Complications of diabetes. You can get approved with diabetes. Diabetes is a big one as well. Hey, Mom, thanks for joining. Complications of diabetes. This one says diabetes is a big one. A lot of companies will decline on diabetes, but most of them are kind of letting that go. Diabetes, they're approving diabetes as long as there's not been any, say, complications. Complications are you had an amputation due to diabetes. You are receiving bad eyesight due to diabetes, or any type of kidney disorder due to the diabetes. That would be considered complications of diabetes. We can get you an approval with this company. The other one is, I think that was it. Any type of diagnostic test. If you're in the middle of getting a test, waiting on test results, you do have to wait to apply after you get the test results to apply with any insurance company. So make sure you are aware of that. But those are some major health issues. We talked about dementia. We talked about cancer, heart, lungs. This company can get you an approval. Now, that's great news. So give me a call if you have any of those issues or you have loved ones that have the issue. We can talk about what that's going to be, what's going to be a part of that. Now, this is going to be an approval for coverage for your loved one. Now, if death occurs with your loved within that first year of getting the policy, what this company is going to do, going to return you back all of the family's money and an additional 10%. Okay, so it's really a return of premium, but it's an approval. And guys, I can't tell you how many people love me when we can help them with this. They're okay with that because they haven't been able to get an approval anywhere. So this company, we can give them back all the premiums plus an additional 10% for that first year. Now, if their death occurs in the second year, the family or the beneficiary gets back all of the premiums plus an additional 20%. So that's a good thing. That's way better than a decline, because most people outlive these policies. So if they don't, what's nice is that your family hasn't wasted any money. They've gotten back every dime that you've put in, plus the company's giving them an extra 10 or 20%. That's more than what you would have gotten if you would have put the money in a bank. So this is great news for those of you who do have some health concerns, some health issues. You may have applied for a policy and they just declined you. You might have had a full pyramid and they declined you. I can help you. So give me a call. My number is down at the bottom. Hey, Cheristine, thanks for joining. Or you can follow me up with your email and I can give you a quote on what it would cost if you have any of these health conditions. But these are fully insurable. It's just that you're going to have that 2-year limited payout. But I always tell people that's better than a decline. Now, if you're healthy and you don't have any of these issues, this is not the policy for you. I'm strictly talking to people who have some health issues or have loved ones that have health issues and they can't get a regular policy with a company. This is a great policy for you. Not for people that are healthy, not for people that, don't have any health conditions. This is only for people that I'm talking to tonight that have some health issues and challenges. I have great news for you. This is a great policy. So give me a call. My number is below, my email is below, and if you have any condition that I didn't mention tonight, please feel free to hit me up, and I'll be happy to answer any questions anytime. I do free policy reviews if you need me to look at your policy. If you need me to do a lunch and learn for your family or for the employees at your job, let me know. I would love to set up an appointment with that. Okay. So hope you enjoyed that. I hope that was some great information for you. So drink your tea with me, and thank you for joining me on Tuesday Tea Time. You guys have a great night. I'll see you guys next week. Bye-bye.